My name is Kerri Aronson, and I am an assistant professor of medicine at Weill Cornell in New York City. I'm part of the interstitial lung disease program here at the institution, and I am also a junior faculty member who is a clinician scientist. And my research program is mostly focused in patient-centered outcomes research in interstitial lung disease. I first and foremost want to thank the American Lung Association for their support of my research. The American Lung Association is a very well-respected organization where the patient community is really at the center of the mission. And that was one of the reasons I was very attracted to applying for the Catalyst Award. In addition, the ALA is also very invested in the growth of junior faculty and physician scientists to sort of establish our own research programs and improve the health and the lives of people living with chronic lung disease. So I was very excited about the opportunity to apply for the Catalyst Award, which supports junior investigators who are in mentored research projects, as a way to help my career and the opportunity to grow towards an independent investigator. So a little bit about my research program overall. So as I mentioned, I am involved in patient-centered outcomes research, and I do a variety of different things within that in interstitial lung disease. One of the things that I'm very interested in is developing and testing interventions to improve things that are important to patients, such as quality of life and symptoms, and knowledge about their disease. In addition, I do some work in development and validation of different surveys that measure things like quality of life and other symptoms that people with interstitial lung disease deal with on a daily basis. And one big part of the research program focuses on people who have hypersensitivity pneumonitis, which is a type of interstitial lung disease that is caused by an environmental exposure. And many people will develop inflammation and often progressive scarring in the lungs related to this. And I became very interested in studying this more as a fellow when I was here at Cornell as a fellow. And I actually did a research project where I interviewed many patients who live with this disease to better understand what the impacts on their quality of life was. And so I learned a lot through that investigation. And one of the things was that in addition to the things that we understand in terms of symptoms that impact quality of life, I also really took away an understanding from this patient population that there's a lot of other sort of psychosocial impacts on quality of life related to trying to identify and avoid exposures, how it impacts people's home life and their work environment. And then another thing that I learned was that the lack of knowledge and understanding about the disease and its treatments was very profound, had a very profound impact on people's quality of life and caused a lot of suffering. And so that was sort of what made me think to sort of move on to the next stage of my research program, which propelled it to think about, well, what are ways that we can actually start to address some of this in our patients who are living with hypersensitivity pneumonitis? And so part of that overall project is actually how I came to apply for the award that the ALA provided and has supported me in the research, was to try to find a better way to educate our patients and really answer the questions that they have about their disease, not the questions that we think they have about their disease. And so our overall goal is to actually develop a peer support delivery of an intervention that delivers both behavioral component and also an education component. And so in order to better develop the educational component, we decided to go ahead and actually interview a group of people living with hypersensitivity pneumonitis in a group setting to try to better understand what are the top priority knowledge gaps that they would want addressed in such an intervention. And so we did something called the nominal group technique in this study, which is a structured group discussion where you have groups of people, you get them together. We did this all virtually on Zoom. It was a wonderful experience. And we asked people to come up with what their biggest knowledge gaps are about hypersensitivity pneumonitis, what keeps them awake at night, what things that they want answers to, but they can't find. And they provided us with those questions. And then we actually, in a systematic, semi-quantitative fashion, asked them to rank, vote on and sort of rank those in terms of what is sort of the biggest priority as a group that they would want answered. And so we did that, and we came up with many questions that people had, and we actually tried to theme them together to sort of see what are the top priority themes. And so, as one may imagine, a lot of questions came up about the natural history of the disease and prognosis. Many questions related to how to identify and avoid exposures and understand when exposures are actually rid of, and what happens if you're unable to do that. There were also a lot of questions on how to live well with the disease and different questions on how to live healthy that may have nothing to do with the treatments related to the actual disease itself, which was very interesting and something that I think we don't address very well in our clinical visits. Also, a lot of questions about treatments and oxygen came up as well. And so we were able to take that list of those prioritized questions and then move on to the next step, was actually answering them for people. And so we've already started to do this using something called the Patient Activated Learning System, which was actually developed by my mentor. It's an online digital health website that is free to the public and free to any patient, and where a patient can go online and look for, what causes hypersensitivity pneumonitis, for example. And that is a question that we answered. And so they can look on the website, and it provides them with an answer in lay terms and patient-friendly text. And that is all based on a systematic review. So all of the questions that we answer for people, we worked with a medical librarian. We did a full systematic review, a full review of the literature to answer the question. And so we have a clinician answer, which is a very long review. And then we took that and made that into patient-facing text. And then there's a knowledge question at the end to sort of assess a patient's understanding of the material. So we've been working on those sort of as the second aim of this project. The first was to actually gather the data of what questions to answer. And now we are putting together those different modules. And the goal is to have those available clinically, but also to be able to use them in future research study as sort of an education component for an intervention. For example, the one that I spoke about at the beginning, where we're going to be delivering a behavioral and educational intervention. And these will be the education materials used. And actually moving forward, I have a K-23 through the NHLBI, where we will be testing this intervention in a randomized control trial. And so these materials will actually be used in that intervention. And so we're very excited to study that. I have a patient advisory committee who has worked with me to help look over all the materials as well. And we work with a whole team on the digital health end that helps us put together the materials. And it's very well done, and it's been very well received. So we're hoping that in our study, we will find that there is some improvement, and it's well received by patients in the randomized control trial as well.